Take a look at this question. A neonate is born shoulder dystocia, which led to injury of the upper trunk of the brachial plexus. Which of the following deformities is least likely to be seen in this neonate? Before answering this question, let us briefly see about brachial plexus. Brachial plexus is formed by the anterior primary rami of C5 to T1 nerve roots. They give sensory and motor innervations to the upper limb. Roots, trunks, divisions, cords, and terminal branches. Remember it as real tough dudes carry books. The C5 and C6 nerve root join together to form the upper trunk, whereas the C7 continues as the middle trunk, and C8 and T1 joins together to form the lower trunk. All the trunks gives rise to two divisions. There is anterior and posterior divisions. All the posterior divisions from all the trunks join together to form the posterior cord, whereas the anterior division of the upper trunk and anterior division of the middle trunk join together to form the lateral cord, and the lower trunk's anterior division continues as the medial cord. And for the branches, there are two branches that arise from the roots. There is dorsal scapular nerve and long thoracic nerve of Bell. Two branches arise from the trunk, suprascapular nerve and nerve to subclavius. And the branches from cords, lateral cord, remember as LML, lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve. For posterior cord, remember ultra, upper subscapular, lower subscapular, thoracodorsal nerve, radial nerve, and axillary nerve. For medial cord, remember 4M and 1U. Medial pectoral nerve, medial root of median nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and ulnar nerve. Injury to the nerve roots cause Erb's palsy and Klumpke's palsy. In Erb's palsy, C5 and C6 is involved, which is the upper trunks of the brachial plexus, whereas in Klumpke's, C8 and T1 are involved. Mechanism of injury: Erb's palsy is usually caused due to forceps delivery or fall or traction. Klumpke's palsy is caused due to fall with an extended arm, breech delivery, etc. Characteristic hand or arm position: this is also known as waiter step posture or policeman tip posture, where the arm is adducted, medially rotated, elbow extended, and forearm pronated. Whereas in Klumpke's paralysis, we see a classical sign known as claw hand deformity. On autonomic signs, Erb's palsy, there is no autonomic signs, whereas in Klumpke's palsy, Horner syndrome is present. Back to our question, as we saw, there is extension at the elbow joint, pronation at radio ulnar joint, sensory loss along the outer aspect of the arm, but there is adduction and medial rotation, whereas here on the option it is given as abduction. So the answer is C.